Good afternoon. Welcome everybody to the Senior Concerns Seminar Series. I'm Martha Shapiro, and I'm the Director of Programs at Senior Concerns. If any of you are not familiar with Senior Concerns, I'll just take a brief moment to let you know about our programs. We operate a caregiver resource center with caregiver support groups as well as one-on-one care consultations. So if you are caring for an aging loved one, please reach out to us. We also have senior advocates. Our senior advocates are available to answer questions about resources, benefits, social security, insurance, anything that you can think of, they're here to help support you. We also operate the Meals on Wheels program for Thousand Oaks and Newbury Park. And since the pandemic, we have started 2 new programs to assist you, a volunteer grocery shopping program, as well as an emergency food and household supply pantry. We now have 2 new programs as well. One is a geriatric in-home assessment program. So you can have a social worker come to the home and do a comprehensive assessment if you feel like you need some guidance and next steps. That's a great resource to you. As well as our new ThinkFit program, which will be starting soon, which is an evidence-informed online fitness program for your mind and memory. And both of those new programs have a lot of great information on our website. So please check it out or give me a call if you'd like some more information. So now I'm really excited to get to our seminar today. We're going to be hearing about updates during COVID-19, where we've been, where we are now, and what to expect. And that will be presented by the wonderful Dr. Carlo Reyes. And we're so fortunate to have him with us today. I am recording this seminar, so if you want to view it again or have any family or friends who are interested, we will post it on the Senior Concerns website. We have a seminar tab on our website. You just go to seniorconcerns.org/seminars, and you can view any of our past seminars that we have recorded, as well as register online for any of our upcoming seminars. Today we are viewing this in our webinar mode, so that means that you as the audience are in listen-only mode, so we can't see you. However, you can still communicate with us. There are 2 options. If you move your cursor on your screen, you'll see there's a chat box. If you have any technical or logistical questions for me, you can type them into the chat box. There's another box called Q&A. So if you have questions for our speaker today, please type them into the Q&A box. We will make sure to get to all of our questions at the end of the presentation. However, feel free to type your questions in as soon as they pop into your mind so that you don't forget them. And then we'll make sure to go through the Q&A box at the end. So now I will introduce our speaker today. Dr. Reyes is a board-certified emergency physician at Los Robles Hospital, the Assistant Medical Director, and the immediate past Vice Chief of Staff. Dr. Reyes attended Southwestern Law School, where he received several National Brief Writing Awards. Dr. Reyes practices healthcare law with Boyce Schaefer Mineri, I hope I said that right, law firm. So I'm so happy to have you, and I will let you take it away, Dr. Reyes. Thank you.
Thank you so much for having me here. For those of you coming here for the first time, I think it'll be informative for you. We did have a presentation earlier during this pandemic, and there's much more new information. I'm going to try to summarize the most vital information that's most up to date. You'll see what I mean by that. I'm going to turn on my share screen. Give me 1 second here. Okay. Let me know if you could see all this. Martha, can you see this?
Yes, that looks good. I see your first screen.
Okay, great. So a lot has happened over this time frame. A lot of new information, and quite frankly, this is new medicine too. What I emphasized in the last talk was all the different new treatments. Some of them clinically appropriate, others not so much. Some of them somewhat validated in real time after we, a lot of times in medicine, we treat people based on evidence-based research, but there's no time for research in a pandemic. So you actually have to try things on the fly. And so over time, over these months, we've gotten to a point where we have an armamentarium of treatment and protection and prevention modalities. So we're much more equipped this fall season, this winter season, this flu season compared to last. So on the first thing to say is that I think that we are better equipped. I think that overall, I don't think we'll see the same numbers we've seen in the past. But that being said, I don't think we could escape the fact that the numbers will rise. That's just the nature of flu season. Coronavirus is a seasonal virus. And so we'll see it increase during the fall and into the winter season. But that being said, I'm going to give you hard facts, but at the same time, updates on some very new information. So our objectives are to talk about incidence. We're going to start with the world and then whittle it down to Ventura County. We're going to talk about very new information on vaccines. The latest story just breaking, I believe, yesterday on vaccines and the promise of vaccines. Treatments we'll kind of review. There are no significant new treatments, but they're more established, is based on what I was suggesting earlier. And then we'll start talking about what's safe, because in the beginning, we didn't know what was safe. Maybe part of the problem is a large proportion of the population didn't believe it was a pandemic, didn't believe it was a real danger. I think that the percentage of people that do not believe in this pandemic is narrowing by the day. But that being said, based on all this information, we could start talking about how long this pandemic is going to last. And we're in the middle of it. Let me just say it that way. We're not at the end. So we'll talk about the incidence of COVID-19, and this is a map of the world that indicates, the hotspots. And there's still evolving research and knowledge about why certain areas are getting hit more and why others are not. If you look at the incidence in the world, it's greater than 51.2 million cases to date. And as of November 9th, yesterday, there was 518 cases, new cases. 518,000 cases. And then in terms of the deaths, it's over 1.2 million to date. And just yesterday, there was 7,312 deaths reported worldwide. So I was going to complete this slide by asking, why are there differences globally? And there's too many things to consider in terms of the differences, one of which is reporting. The idea that some places report more, some places report less. The epidemiology is different. India, for example, being a very populated area, I actually doubt that their reporting is accurate, for example. So although this map may suggest that India is less hit, for example, I'm not sure if that's the case, right? And that goes with all the other countries. Some countries are more forthcoming with their numbers and some less. So that's one aspect to consider, right? So we need to take this data with a grain of salt, so to speak. But the only data we know more accurately, I would say, is our own, in a sense. In terms of, if you look at us, we're in the red, but you look at Canada, there is a lower intensity of cases. So one thing to consider is there are other factors that have caused a lower incidence or higher incidence. I think that one of the things that I suggested earlier in the talk was that there was an arc of understanding about the incidence and the validity of COVID-19, for example, of the coronavirus. And I think back in the beginning, our country had difficulty, many in our country had difficulty believing it was a real condition that we had to worry about. And so that's another factor, is like how homogenous is our society in both believing that it is a real pandemic and then adhering to the rules and safe practices of preventing spread of this virus. So as you can see, I think the incidence is not just scientific, it's also potentially political, socioeconomic, and other factors that play into this incidence. In the United States, our incidence has had some interesting peaks and valleys, so to speak. On the one hand, we had a peak and a valley when we had the terrible onset starting at around March, April, May, June, and then it started to subside during the summer months. And that's, again, what we typically see with a seasonal virus, right? And so now here we are in November, and we're starting to see a rise again. And that's what we're seeing across the country. So our case numbers are going up. I think that our ability to test is higher, and therefore the incidence of positive tests is increasing because we're able to test. Whereas 6 months ago, we weren't able to test robustly. And so as we are more able to address the epidemiology aspects of this pandemic, we're going to see higher numbers just because we're testing more. Okay, that doesn't mean it doesn't exist. It just means that's part of the play of how to interpret the numbers. I think that hospitalization rates were high initially because for various reasons. First, these were novel cases. We didn't know how to treat these conditions. We were careful with these conditions and how to manage. I think over time, I think that our hospitals are getting better at managing COVID-19 cases. We know in terms of our risk of spreading disease, so the ability for hospitals and facilities to engage more in preventing the spread with what's called the universal precautions, really appreciating the fact that protective equipment is so important. PPE was critical in the beginning, and the sad fact is that many hospitals and many places did not have enough to go around. And then the supply and demand and the resources of protective equipment was a big concern initially. Fortunately, there are a lot of entities that are providing that. The California Medical Association is actually providing PPE to physicians in California, and I would imagine this is happening likewise across the country. I've seen people donating their PPE to hospitals, which has been just tremendous. So you could see how the focus on hospitalization rate has gone down just because we're safer in the hospital. We understand the conditions and how to prevent spread. As you notice here, like the red line and the yellow line, they were down and they're starting to creep up a little bit at the end there when we're going into October. I anticipate that those lines, which represent COVID-like illness and flu-like illness, is going to go up because of the seasonal aspect of these flu viruses. All right, so again, to summarize United States, we're going up again. I think what we're seeing in the United States also is that there's certain places that are hotter than others for various reasons. They're probably different on their kind of the rate of spread for various reasons, but for the most part, all of us are kind of going up. When you look in California, we have COVID-19 spread of 971,000 cases. As of November 9th, we had numbers as of November 8th. Again, I'm bringing this up as I literally made this slide deck yesterday and today to get the most up-to-date numbers. You could see that the number of confirmed cases spread by age. And it looks like the interesting thing to look at is the 18 to 49. There's a lot of cases in that age range, 580,000, okay? I want to suggest something about that. I think that I believe that pandemics spread based on just human behavior, the types of activities that people engage in, whether or not they believe the pandemic exists or not. And so you could see how it seems that the 18 to 49 age tend to be maybe a little bit more out and about, maybe engaging in more activities, and therefore more spread in that cohort. Males versus females is about the same in terms of number of cases, roughly. And then as of yesterday, there was 17,977 fatalities due to COVID-19. I'm happy to say that the one thing that we were concerned about in California, and I'm sure all states were concerned about, was what is the impact of COVID-19 on ICUs We saw the horrible situation which occurred in Italy and other places earlier on in this pandemic when there was literally, ventilators and ICU beds were just not available, and they were overrun in some places, and it was very tragic. So from a societal perspective and from a health safety perspective, much of the focus for our state government has been focusing on making sure that we have enough ICU beds and enough resources. And it appears that we are doing a pretty good job with that so far. And certainly we'll get into Ventura County. It seems that we're in an interesting pocket of relative safety. I don't want to give anyone too much. Let me just put it this way. I think that we all need to be careful about COVID-19, but I must say that Ventura County has not been hit to the same level as other places like New York, et cetera. So this is, I just got this from today. This is our incidence in Ventura County. There was 339 new cases yesterday. Total cases, 15,000. And the majority of those cases fully recovered, for 14,228. There's been total hospitalizations is 1,100, and total ICU admissions is 237. So a very small percentage of the total cases required hospitalization, and even a smaller amount required ICU. The total deaths is 171, and new deaths is 2. So in comparison, when you look at our census in Ventura County, it's relatively small, but obviously because of the infectivity of this virus, we need to keep track of it. And if the rate of rise of the cases goes up, then we get concerned about what it is that we're doing. And sometimes we need to parallel it with things that are actually happening. Are we opening up schools too soon? These are the questions that I think that you're all going to ask. Are we doing things that are actually making this pandemic spread easier? And so that is why we need to keep track of this on a day-to-day basis. So that's our incidence. I want to skip to something really promising, and that's something that was announced yesterday, that there's some phase 3 trials of a vaccine that was conducted by Pfizer and BioNTech. Apparently there's a 90% efficacy in protection against COVID-19 after the second dose of vaccine is given. So what's suggested is that a vaccine can provide protection after 28 days after it is given. There's not been reported any initial safety concerns, but it is a phase 3 trial. So there needs to be bigger trials that are ongoing. And so we need to get more information, but this is probably the first positive thing we've heard about vaccines since this pandemic started. Interestingly, once that was announced, then, it really affected the global stocks, so stock market improved dramatically after that announcement. You can imagine what it does for businesses, what it does for airlines, what it does for all these other companies that rely on a vaccine to hopefully restart their businesses. This really goes into the financial impact of what a vaccine can do in opening up everything. The reality is we're nowhere near opening things up based on the presence of a vaccine, because not only do you have to produce this in large quantities, but then you have to distribute it and administer it in large populations. It remains to be seen who's going to be allowed to be given the vaccine first. Everyone has their opinions, but at the end of the day, we're still in the beginning phases of how this vaccine could hopefully stall and then ultimately end this pandemic. But like I said, this is great news. This is the first time that we're really getting positive reports of a vaccine. So we talked about vaccines. Certainly, that's so important from a epidemiological level, a global level, right? Because not only are we going to get vaccines in this country, but in other countries, we need to also talk about other ways in which we could prevent spread. And prevention really is the most critical part. Preventing from having the disease is obviously the most effective form of quote unquote treatment, right? If you never get it, then you never have to worry about it. There are methods and means by which we could protect ourselves. I think in our last talk, I talked about masks. It was comical almost and frustrating for sure that masks was even a question as to whether or not could be effective. And COVID-19 became this topic of so much debate. And I don't know why masks became a debate, because we were wearing masks during the 1918 pandemic. We used masks in hospital from an infectious disease perspective to begin with. So the science has always been there, but I think that whether it was pundits or political agenda, it became a question. And I don't think that we did a very good job as a country to really disseminate accurate information. So masks are critically important. Obviously staying at home if you're sick. I was talking to friends the other day about, why is it that our spread is not as bad as it was in the beginning. I think part of it is because, one, people may have not believed that they could get it for whatever reason, so there was a sense of denial. Two, there was also a sense of questioning about the science of the pandemic and whether or not it was just the flu or whether it was some really novel virus that was actually more dangerous. Now it's different. I don't know as many people that are questioning the presence of this virus and the fact that it is actually very dangerous for certain populations. And so I think that a lot of people are just staying at home when they're sick. They're being very cautious and being very conscientious of the rest of our community. I think that's another reason why why people are preventing the spread of disease. One thing I want to mention is that pulse oximeters are actually an important way to not only determine, it's not going to diagnose whether someone has COVID-19, but if someone has symptoms of COVID-19 and then they have an oxygen status in their bloodstream that's low, then that is highly suggestive of COVID-19. So I mentioned this for the patients that I treat in the emergency department. They're usually available on Amazon. They were much more accessible before COVID-19, but unfortunately, the law of supply and demand, they're more expensive and harder to find now. But a pocket pulse oximeter is a really easy way, not only to kind of screen yourself and your family if they may have it, but also to track COVID-19 if you do have it. Because as we'll see, most COVID-19 infection is actually very mild. And so during the beginning stages, you could use your pulse oximeter to determine, am I having a more serious version of it, or is it very mild? Now, as part of prevention implies also the importance of quarantine. So if you either have symptoms of suggestive of COVID-19, or you were exposed to someone that had or has COVID-19, you could be either an asymptomatic carrier, meaning you're not having symptoms, because you may not have it, or you could be a pre-symptomatic carrier, which means that you're going to have symptoms, but you don't currently have. So the safest route that's recommended by the CDC and other authorities is to quarantine yourself for 14 days. There are other ways in which you could shorten that quarantine. I think a return to work protocols are in place. For example, if you don't have symptoms by day 5 and you do testing by day 7 to 10, then maybe you could return sooner. There are things like that. But I didn't really find established guidelines, and certainly none that is supported by the CDC. My gut feeling is obviously the safest route is to quarantine yourself for 14 days in either case. And then finally, avoid risky situations. I'm going to show this. So here are the risky scenarios. Okay, it's a very busy slide, but let me explain what this is. So if you look at the top in the low risk section, some things like opening the mail, getting restaurant takeout food, pumping gasoline, although I would recommend people wipe their hands with an alcohol-based hand cleaner before and after doing that, going camping. So these things tend to be low risk. And then if you go further, grocery shopping is moderately low. I would imagine playing golf would be very low, but I mean, I guess it depends on the scenario there. Staying at a hotel is pretty pretty low generally, things like that. And then if you just read the list as you go all the way down, at the very highest of risk, going to a buffet, which is impossible because buffets are closed, working out at a gym, certainly amusement parks, music concerts, can't do that, sports stadiums. So you could tell that the difference between low risk to moderate to high risk is really probably the biggest issue is closer and longer interactions and crowded situations. So any scenario in which we are near a lot of people and you're near a lot of people for a longer period of times, those are going to be the highest risks. If you're in places that are indoors that potentially have poor ventilation, then that's another risk as well. Incidentally, someone asked me about flying a plane. Planes have HEPA filters. They tend to be safer. I would still wear my mask. I would still take all precautions. But you know, and I certainly wouldn't fly unless it was something that was important. I don't think anyone's really vacationing as much. Those types of things. So just use your best judgment. Higher risk scenarios, anything with alcohol, you know, in bars, even if with the best ventilation, even if it's outdoors, that sounds safe. But as soon as you get alcohol involved and other people become more unpredictable, will walk up to you, will touch you, etc., that type of thing. And then another interesting thing was early on in this pandemic, religious services and singing. We had that terrible case, I'm not sure where it was. I'm not sure if it was Minnesota or some one other place where they opened up choir practice and many of them contracted COVID-19, presumably because of a combination of crowding, poor ventilation, and prolonged being there for a prolonged period of time, and people literally vocalizing and ultimately spreading the virus that way. So another aspect that I get all kinds of questions about is the idea of whether or not school should open up or not. I mean, I have people on throughout the spectrum arguing all different aspects of it in my family, friends. It's a debate, truly a debate without a definitive answer. You know, I think that the general approach is that we should make our own decisions for the safety of our family and our children. And I think that that's the approach now. On the flip side, the reality is for each day that a school is not open, they're not getting any federal funding. They risk a lot. There's a lot of financial impact on many levels, right? Financial impact for the schools, financial impact for parents who have to arrange more childcare or stay at home and things like that. As some businesses open up, there's so much in terms of that impacts children when they're not interacting with other children, and the psychological toll that places on kids. The reality is we're in a time where it probably happens every 100 years where we do have to make changes to stay safe. There's the in-person aspect of schooling is moving towards a hybrid level or hybrid approach in Ventura County. For some of us, it started a couple weeks ago. For others, it's going to start next week. And the whole idea with the Ventura County approach is to practice social distancing while at school, which is the safest and the recommended way to do it according to the American Academy of Pediatrics. Private schools, if you have kids in private schools, they're probably a little bit more capable of doing it, maybe because they're financially able to do it and things like that. But at the end of the day, it's really a personal preference and kind of comfort level for each of you. I will say that kids tend to have less serious infections. I think this has been borne out of all the studies and all the information we've received initially in New York and in other places throughout the East Coast and the Midwest. The kids tend to just not get serious infections. There's a cohort of children that can get delayed kind of complications that had infections that were not serious. It's such a small number, and so we don't really know enough about that. But at the end of the day, it comes down to a couple things. One, the age of the child. So if a child is able to wear masks and able to control their environment by staying away from other kids or keeping that distance and frequently wash their hands with a sanitizer, then the safety is as minimal as it would be for us if we go work or go to a grocery store, et cetera, as long as we're being conscientious. But obviously, the younger the child is, the harder it is for them to protect themselves. So I don't even really have a good answer one way or the other. But I will say that I think that it's a personal choice. I don't think that there's, in effect, a right or wrong. I think it's just what you all want to do. I'm sure there'll be lots of questions about that when we move on to the question answer. So we talked about safety measures. We talked about incidents. Let's go into our own backyard, so to speak. Let's go into Ventura County. To the right, you see what the tier philosophy is, right? So right now we're in the red tier. And we've pretty much been in the red tier. October 24th was a time when we were starting to feel pretty good about things. The Ventura County Star reported that schools are pushing to open due to improved health conditions, and that's after the months of late July and August. And September, we're starting to look better and better. And then, 16 days later, we got 339 COVID cases over the weekend. And then today, the San Francisco Gate reported 11 counties fall back to more restrictive tiers as COVID-19 surges. Why did this happen? Well, I think we mentioned why it happened. It's because we're moving into the fall season, the flu season, the winter season. So this is going to happen. So the point of this tier is that we will slide up and down along this tier. It is very possible that the hybrid schooling will open and then a week later close. That's just the reality based on this tiered approach. And so we need to keep track of that. So right now our 7-day positivity rate is 4.2. which is a little higher than it has been. It hasn't been over 4% apparently since August. So you can see where we are starting to ramp up in our cases. When you look at the 7-day average of Ventura County, to the left, this graph shows a 7-day average case rate per 100,000 in Ventura County, and it's moving up, and it almost looks like we're approaching the purple tier, okay? When you go by positivity percentages, we're a little bit lower. So the important thing about these two graphs is to look at the trend. The trend is we are going up, okay? So let's take it back to safety, practices, schools, and now our incidents. In Ventura County, we are going to be going up. I do think that we need to have a more heightened approach in terms of keeping ourselves safe, keeping our congregations to a lower number, for example, and not being out and about if we really don't have to be. Probably the two most important things in terms of prevention is staying home if you're sick and you might have COVID, wearing a mask whether you think you have it or not in front of people, and then frequently washing your hands with a hand sanitizer. Okay, so we're going to switch gears. We're going to start talking about testing. We didn't touch too much into testing. There was a lot of variables with testing the last time we touched upon this, partly because there were so many companies that were trying to push out testing, and it ranged from pretty accurate to very poor. And so we didn't know which tests we could rely on, which tests we can't. We have more information now. Generally speaking, there's two types of testing, okay? They're both basically swabs. One test is called the PCR test. And what that tests for is it tests for the RNA material of the actual virus. So it tests to see if the virus is actually present in your mucous membranes. So in a sense, it's testing for active disease. So it was very accurate in detecting active infection. And the best way to test for that is the deep nasal swab. Okay, you could do a cheek or oral or et cetera, but those aren't nearly as sensitive as the deep nasal swab. So when they say deep nasal swab, they mean putting the swab all the way to the back. You're almost tickling the back of your throat through your nose, if you can imagine that. That's the appropriate way, and that's how we do it in the emergency in the hospital. The other type of test is an antibody test. The benefit of this test is that it's actually quick. We can get a test result very quickly, but it identifies the protein fragments of a virus. So what that means is the virus may be alive or dead. What that also means is the patient may either have active infection or they had infection weeks ago and they're no longer infective. So what that means is that a positive antibody test doesn't really tell you if you're actively infected or not. Okay, so it could be okay as a screening test, but at the end of the day, the only way to tell for sure is the PCR test. So if you're wanting to get a test out there and you're at an urgent care, there's so many places where you can get it. Ask for the PCR test because that's the one that's most accurate. We talked about testing protocols briefly. I'm going to incorporate the quarantine approach and testing. So whether you're asymptomatic with a close contact or you're symptomatic, the recommendations are generally the same. You quarantine for 2 weeks, you do the PCR testing, and you may need a second PCR test if the first one's negative. Ultimately, 2 negative PCR tests could shorten your quarantine period. So for example, if you get the first test day 3 from exposure, and then by day 5, you get the second test and you were never symptomatic, and that in theory could be enough to get you out of the final week of that quarantine period. That being said, if you still have symptoms and you take the first test and it's negative and the second test negative and you still have symptoms, there's still potentially a question, I have to say. So it's a little bit tricky, but this is something that you'll have to talk to your doctor about if you're in either scenario, which test to take, how many times you need to take it, and how that impacts your quarantine. Like I said, at the end of the day, a 2-week quarantine is safest. Other times we do tests is in the hospital. We'll do COVID-19 testing before procedures and during the hospitalization. That's ultimately to protect spread in hospital. So pre-procedure to protect the doctors that are doing the procedure. That's a very vulnerable situation for a doctor if a patient has COVID-19 and they're doing a procedure like a surgery or something like that. And furthermore, hospitalizations, we separate patients that have COVID-19 from those, or may have it, from those that definitely do not have it. And the only way we can tell if those that do not have it is to do the testing. So that's another reason why hospitals are so much safer than they were in the first months of this, because we just did not know nearly as much as we know now in terms of preventing spread, treating, and being safe. CMS, the Center for Medicare and Medicaid Services, has mandated skilled nursing facility residents to get COVID testing as well in a move to try to keep skilled nursing facilities safer for residents and the staff there as well. Okay, so the last question that I have for us is, how long is this pandemic going to last? I obviously don't know the answer to that question. Now, when you think about comparing it to the 1918 Spanish flu, it lasted about 2 years. There was a second huge wave that was thought to be due to a virus that mutated and was spread by military troops that went across countries. And that's what caused the spread. But it ended within 2 years. What's different between then and now? Well, we have much more access to international travel. We're much more populated. And I think that in that scenario, it may take longer when you talk about that, okay? The fact that our behaviors are different now than they were in 1918 and 1920 could potentially prolong this pandemic. What are the ways in which we could reduce the time frame of this pandemic? One, a vaccine. So there was no vaccine in 1918. There is the potential for a vaccine now that could literally prevent the spread of this within a year and a half. So that is our biggest promise to preventing, to limiting how long this pandemic is going to last. But ultimately, it also goes down to behavior and policy. Our community leaders and our political leaders promulgating safe policies to prevent the spread? Are we looking at our own behaviors? in terms of preventing engagement in certain activities that are more risky than others. It really comes down to us in a way. It becomes a question of human behavior, how long this pandemic is going to last. I am hopeful, I'm optimistic. We've done so much in the past. It was March when we really got into it. And so now it's October. So in this past 8 months, our science has improved, our best practices in medicine has improved, our safety measures have improved in hospitals. I think that our leadership is, kind of our community leadership, both county and statewide is more knowledgeable and improving. So I am optimistic, but at the end of the day, I'm gonna end the discussion, my presentation with this. It comes down to our own behavior and being mindful for others in terms of how we behave. Thank you very much.
Wow, thank you so much. Oh my gosh, there's so much excellent information. I know we do have some questions. This is one of those presentations I might need to watch again too, because it's so useful and factual and specific to our county, which I just think is really should be our guiding factor on how we operate going forward. My goodness. Okay, so we'll start with some of our questions. I know one was, if I'm 65 or older, is it safe to go to the grocery store or should I be having them delivered? And I'd love for you to speak to that too, because we are seeing the incidences go up again. So if we had been going, is it time to dial back, or are we still safe if we wear masks and wash hands and all of that?
That's a really good question. I'd like to answer it this way. In medical school, we were trained on something called universal precautions, okay? And the idea of that was when we go into surgery, there's a way we put on gloves, there's a way we put on a gown, there's a way we put on a mask. And then everything in front of us is what's called a sterile field, okay? There's no germs in front of us, and we do not introduce germs into that sterile field. And that's the only way we could be safe when we perform procedures and do surgeries. That is a time-tested and valid way to prevent infection in procedures, right? The better you are at it, right, the lower your risk of infection for the patient, right? The worse you are at it, then patients have more infections after procedures. It's just the way it is, all right? It's the same thing with going to the market. The more you're careful, you should be fine. But it takes so much conscious effort to be that careful. So I think that I'd like to take a kind of pronged approach to this. One is limit what you need to do when you go to the market. Don't go back and forth. Just be mindful with how you go to the market and you go to other stores and things like that. So if you limit the number of times you go, that's in itself reduces your risk. I don't think I would like to recommend that you prohibit yourself from going. I think that if you really are careful, you can prevent the disease. The other thing that's different now than 8 months ago was that I believe people tend to be staying home when they don't feel well. They're not walking around with a sniffle, rubbing their nose, and then getting an apple and walking to buy it, I think people are so much more conscientious now that I think it is relatively safer, you know what I mean, compared to what our behavior was before, because we are more conscientious. That being said, my short answer is this: limit your exposure as much as you can, but go out a little bit. I think that staying indoors all the time has a psychological impact that's also not very good for us.
Thank you. And on the same lines, there's, of course, naturally, several questions about how to be safe out in public. If I'm a single senior, can I visit with a friend if I stay 6 to 10 feet apart with a mask safely, or do I need to stick to Zoom?
Good question. I think that the first step is to ask your friend if they've had the infection or if they're not feeling well. I think that if they're having potential infection, then I don't think it's even worth the risk to go there with a mask. I think it's like, let's just Zoom. I think that would probably be the safest way. I tell my kids that, because my kids, I mean, I can't lock my kids in a house, in a room all day, and, they're already in a room all day with Zoom. So, I tell them, I tell my adult age kids, my 22-year-old is just ask the questions, and if the people are sick, then just stay away. If they say they're not sick or they recently tested and they're totally fine, I believe that a mask in a safe distance of 6 feet or more is safe.
In an indoor setting as well, or just an outdoor setting?
Good question. The CDC suggests or indicates that if you're in an indoor setting for a prolonged period of time and the ventilation is questionable, then that does increase your risk a little bit. So I think that finding best case scenarios would be outdoor. We're going into the winter season. It's cold outside. I think distance and making sure that things are nicely ventilated would be safe. But again, you got to use your best judgment.
Okay, thank you. The slide that you had on the screen about the risky scenarios and the different risk levels, somebody is asking for that. Is that something you could email me and I can send out to everybody that signed up?
Absolutely. Will do. I could send the whole presentation.
Hard to see everything. Yeah, that would be fabulous. Thank you.
Yeah, sure.
Okay, this person says, I realize that 14 days quarantine is the standard, but I read an article in which an asymptomatic immunocompromised 71-year-old woman shed the virus for 70 days. If so, how effective is the 14 days?
It's a good question. I think it depends on the testing too. So let's say that you're 14 days out and on day 14 you do the test. Presumably if they're shedding virus, that test would be positive. So there are scenarios in which, this is a unique scenario, someone that continues to spread, to shed. And so that's where the testing becomes really important. I don't think 14 days is the end all definitive safe time period if there's a positive test that continues to be positive.
That makes sense. So 14 days is really just if you've been exposed, that's sort of the length of time. But if you're already positive, then you need to keep testing.
Right. And I think the other question is, was this person symptomatic? If they're symptomatic, then, and there was a history of COVID positive testing, and they continue to be symptomatic 3 weeks in, then I would assume that they're still COVID positive and still shedding. If they're symptomatic and become asymptomatic within 2 weeks, then that suggests that they could be finishing their infectivity period. But at the end of the day, the test could potentially trump that. If it's still positive, whether symptomatic or asymptomatic, I would be more concerned about the test still being positive.
Gotcha. Okay, thank you. Then somebody's asking if you can go over the latest therapeutics being used if a person has to be hospitalized to help shorten their stay and severity. That's probably
Sure.
a large question, but.
Yeah, no, and I touched upon it in the last talk and didn't put it on this one because there was so much other information that was so new and like just good I needed to present. But remdesivir is an antiviral that is used for COVID-19 patients that are on the moderate to very sick range, where their oxygen saturation is very low. You want to try to potentially prevent putting someone on a ventilator, and there's a way that you can do that with this medication. It remains to be seen how effective this medication is, but it's something that is ongoing in terms of studies. I've seen kind of studies on both sides as to whether or not how helpful it really is. The things that I've so far seen that tend to be very helpful, one is intravenous steroids when they're moderately sick. That tends to really help tremendously. And so that is our standard of care, to give IV steroids to moderately sick patients with COVID-19. The other thing is to actually try to prevent placing a patient on a ventilator. There was a lot of confusion and early on because again, this is a new virus. Not only is this a new virus, but this is a virus that did not behave the way that typical viruses behave in terms of the pathophysiology. Usually you put someone on a ventilator when they're sick from a pneumonia due to a virus or bacteria, you're actually moving in the right direction. And unfortunately, what we found is that people that were placed on a ventilator when they were sick from COVID-19, if we placed them on a ventilator too early, it actually worsened their injury to their lungs. And so what we do now is we try to prevent placing a patient on a ventilator as much as we can. There's new modalities to give oxygen. High flow nasal cannula is a means by which we can give oxygen to a patient without having to use a ventilator. And patients look much more improved on it. Their respiratory distress improves. And I've had several cases where I was able to place patients on the high flow nasal cannula, prevent ventilation, and 2-3 weeks later they walked out of the hospital. So I was very happy to have that to report to you all, so we feel more comfortable in how to treat that. So those are the primary means: is really supportive therapy, providing oxygen, preventing ventilation as much as possible unless it's absolutely necessary, IV steroids, and then some antiviral medications that we give for very sick patients.
Wonderful, thank you. Now we have a couple questions about Thanksgiving. So this is obviously a very important topic, which it is to me too, so I'm excited to hear these answers. So one specific question is about testing. So if I want to have my, kids and grandkids over, if they take a test before they come, can't they come and be inside my house?
Good question. I think a lot of people are already utilizing that approach. Family gatherings, let's all get a test, right? The first question is, what's the test, right? Because as I said before, if you're doing the antibody test, I don't know. If you're doing the PCR test, more accurate, okay? The second thing is really swinging into the other aspect of this, which is there anyone that has symptoms, even mild symptoms? Let's say it's just a sniffle, We know with the COVID-19 infection that even with a sniffle, you could be infected, you could spread the disease, people can be asymptomatic and spread the disease. And the other thing is that the testing is not 100%. It just is. Nothing is 100%. Nothing in life is 100%. And so, although testing is going to be reassuring, especially the right test is going to be reassuring, it's not 100%. So what I say to people is, again, limit the amount of exposure. Thanksgiving is going to be tough. In the same way that Halloween, people were afraid about Halloween. Oh my gosh, what's going to happen? Who knows? Maybe this spike from this time is a reflection of what happened, what we all did in Halloween. It's certainly possible, because although there were parties that were going on, I'm pretty sure people didn't talk about it, but I think people were doing stuff, So at the end of the day, your question is, can we do a test and then have Thanksgiving? I think that would be increase your safety by doing the right test. 2, and practicing the safe distancing protocols at the party, wearing masks, all those things would be helpful. And then 3 is really limiting the number of people at that Thanksgiving gathering. So I haven't seen my extended family in the whole time. I've pretty much seen my parents, my brothers, and my own family. That's pretty much my circle. And I'm probably going to stay that way for a little while.
And another Thanksgiving scenario is if friends want to do a get-together outside where everybody brings a dish from home, but we sit at our own family pod tables and there are 6 households represented.
I think we could apply the same rules. I think ventilation was good if people had safe distancing. I've seen people doing that, neighbors doing that, and I think that's probably fine. I think the issues are, kids running around. It's very easy for kids to just start playing and then all of a sudden, they just, I've heard of cases where earlier on, parents were allowing their kids to play, neighbors, and then sure enough, within a month, several of them were contracting COVID-19. So it comes down to really safe practices and behavior. If that can be achieved, then I believe it would be safe.
Sure, because if we're eating, we aren't going to have masks on.
Right. So, but if the distancing was there, it's similar to, this kind of segues into the question about, is it safe to be at a restaurant, right? So at a restaurant, if you're indoors, the ventilation may not be good. You're right up next to another person. Not so safe. But if you're outdoors, they're really spacing people. People use their mask and when they're not eating or drinking. It's more safe, you know. So I don't think I could stamp fully safe on anything, quite frankly, but I could tell you what's more safe and what's less safe. And I think that, you know, engaging in those those behaviors is something that we're all might have different answers to personally. Personally, I'm going to give you my answer. I don't feel like, I mean, I go to restaurants that I feel are safe. That's just me, you know. I wear a mask all the time in public, you know, unless I'm alone in a field. I'm going to wear a mask if there's people that could be near me. So that's how that's how I conduct my life. Going into a restaurant, well, if they're not conducting safe practices, I don't go.
It is difficult because we want you to give us your stamp of approval, right? I know the feeling, like we just want your permission, but the reality is everything we do is somewhere on that chart that you said. There's a amount of risk in anything, so it really comes down to how can we reduce it as much as possible, and then what amount of risk are we comfortable with?
Right. That's what you're comfortable with, and then reducing the amount of the exposure. Like instead of going to the market every 3 times a week, go once a week. You know, those are the things that matter too, you know, and the times of day that you do things, you know. Friday night and Saturday night at a restaurant, super busy, you know. Wednesday afternoon for lunch, not as busy, you know. So I think that all these little decisions that we make could impact ourselves and improve the safety.
So true. Absolutely. Thank you. Okay, this question says, if COVID is airborne and one study says it can stay on plastics and metals in ideal situations for 3 months, how can one clean the interior mechanisms of our heaters and air conditioners so that we know they're safe? And actually, I'd love for you to touch on this subject because when it started, we were much more concerned about it on surfaces than we seem to be now.
Right. So first of all, there's no data that's suggesting, like there are certain conditions where you can get the disease from infected water in the air conditioning ducts, for example. This is not that disease. You see what I'm saying? People worry about how we can get it just because it's a particle. Can it be anywhere? Could it stay there forever? And then we're always going to be at risk for it. That's not this disease. We don't have to clean all the minuscule surfaces in our air conditioning ducts. We don't have to, but I think a HEPA filter would be helpful generally. Ventilation in the hospitals. I think ventilation, opening the windows, you know, once a day in your house would be just clearing everything out would be helpful. In terms of surfaces, it's probably more important to keep your hands clean. So to have that hand sanitizer with you at all times. To keep your house clean generally, but when you go out and about, when you go to a restaurant or a market or whatever, just to constantly, okay, I gotta, wash your hands a little bit, whenever you're touching something, that's more important than keeping every surface around you clean, first of all. And then what was the other question? It was the ducts, I think we talked about.
Yeah, which you mentioned, you don't have to clean all inside of them.
Yeah, there was some commentary about, I think Dr. Fauci mentioned this, is that it's probably more important to keep your hands clean than to wipe surfaces down, generally speaking. Mm-hmm. So if you focus on your hands, then you're not going to infect yourself when you touch your nose, right? But I'm not going to worry about what's over there. I'm just going to worry about my hands. I think that's really the general idea.
Okay. And then this one kind of follows up on your restaurant one. What should you do if someone sneezes or coughs near you in a restaurant, for example? Is there anything, I know. Like if we think we've been exposed, that we can do to help strengthen our immune system?
Okay, so the first part about sneezing, yes, sneezing can spread. That's the whole point of a mask, right? So if you keep a mask on and you sneeze, then you protect everyone around you. You just did everyone else a favor. if someone sneezes on you and is a stranger, and it's a relative risk for sure. But I wouldn't consider that as a known exposure risk where you have to quarantine yourself for 14 days, if that makes sense. In terms of things that can help you stay safer, and in terms of boosting your immune system, there's all kinds of information on that. Whether or not things are true or not, I don't know. There are some interesting studies that have suggested just staying healthy and exercising regularly boosts your immune system. Yeah, I think that the reason that COVID-19 seems to be worse on people with comorbid conditions, and so this is a time to try to get healthier, watch what you eat, walk around, exercise. I mean, those are the things that are going to help you probably more than anything else in terms of your immune system.
That definitely seems like the best answer, but I was hoping you could just give me like a magic pill to take. So, okay, I'll work on being healthier. As with anything, I guess, that's the best way to strengthen ourselves. I know that it's 5, but we still have questions coming in. Are you able to stay a few more minutes?
Sure.
Okay, we'll get through some of these other questions then. So do you expect that there will be another spike with people traveling for Thanksgiving and gathering?
I think so. I mean, again, pandemics are a product of human behavior. And I've said that probably 6 times in this talk. And in times like Thanksgiving and Christmas, and other holidays, when there's just the nature of having gatherings generally, more people will have those gatherings. More people will get on a plane. And that's just the nature of it. It's unfortunate. I think that we're all human, and sometimes we make those decisions. I'm not here to judge anyone, but I am here to say that we should all try to be as careful as possible, especially during this time, and especially for people that have comorbid conditions, people that are older, people that are immunocompromised. These are the people that are really so susceptible to the worst part of this disease. So we need to protect those people and be mindful for them.
Mm-hmm. Absolutely, thank you. Can you explain a little more about what Pfizer means when they say that it's 90% effective, and how early would it be safe for an elder who is immunocompromised to take the vaccine?
I don't know the answer to the second question. I think we're so early in the testing phase that I don't think we're going to see, the broad administration of this vaccine for months. In terms of the first question, so can you repeat that first question again?
Explain what Pfizer means when they say that it's 90% effective.
Yeah, so what they did is they're doing a bunch of different analysis on the data. They put people in 2 different cohorts, those that had the vaccine given to them and those that were given a placebo, okay? And then they exposed them to the vaccine, okay? And the early studies, the phase 3 trials are indicating that 90% of people that got the vaccine were protected from getting the infection. So let's say it were 100 people, 90 people that got the vaccine did not get the infection, and 10 people did who got the vaccine.
Gotcha, thank you. Then there's, so somebody was saying that they don't eat restaurant food that they haven't recooked or reheated when they bring it home. And I would love to ask you about that too with food, because the other question came up about Thanksgiving. If people cook a meal at their home and then bring it to a group gathering, what is the information on transmission through food?
It's there are no studies. There's nothing that suggests that there's a significant transmission due to food. And if you think about it, even during this pandemic, when Uber Eats and Postmates and all these companies just boomed, right? Probably the only sector of business that boomed during this. We didn't really see spikes. We didn't really say, oh no, it's because of this. I think that was born out of fear. in concern. Well, validly, because we didn't know anything about the virus back then. Now we know that we're not seeing anything associated with food transmission, thankfully.
Mhm. Good. I know at the beginning
Well, good.
I didn't do takeout. Now I can't live without it. Then there was a couple questions about sanitizing. So one was how effective are whole room UV ozone sanitizers, which I've never heard of, and how can we expel the ozone after? And the other was about UVC light for sanitizing surfaces. Do you have any comments on those items?
Yeah, I mean, those are kind of industrial based to clean surfaces. Some hospitals use UVC light, for example, to clean intensive care unit rooms between, when a patient that had COVID was was in a room there, then they have to sanitize it. So some hospitals do that. All of those do the trick. The question, kind of the hidden question is that something you should do in your house? I've had several cases where people had injured themselves using UVC light, for example, where they crawled into spaces to clean air ventilation ducts, and they ended up causing injury to their eyes from it. Kind of like you're staring at the sun in a way. Right. when you're doing that. So I think the practical answer is that if you don't know how to manage and use those modalities, then I wouldn't recommend using them at all. The second thing is I don't think it's necessary. Going back to what Dr. Fauci said, if you just focus on yourself and your hands, then you should be okay.
Okay, thank you. I know there's a couple more questions, but I also want to be mindful of the time. So I am going to finish now, and if there's some pressing questions that we didn't get to answer, please reach out to me and I will pass them along to Dr. Reyes. I just want to thank you so much. This is so incredibly helpful. I hope we can just do this every couple of months because your knowledge is just invaluable. And to be able to pick your brain and hear from somebody who's working, caring in our own community is just amazing. So I very, very much appreciate your time and thank you for coming. I just wanted to let everybody know our next seminar will be on December 3rd, and that is called Financial Self-Defense, Staying Smart About Common Scams, and it's presented by Debbie Deem, who's a former FBI victim specialist. So please do sign up for that one. I think that's really important as well. Also, I wanted to mention, you talked about pulse oximeters, and Senior Concerns has been working to create COVID-19 toolkits, which does include a pulse oximeter, masks, gloves, cleaning supplies, and a whole booklet that we've created on how to stay safe and healthy at home. And we make those available to people who are 75 or older in our service area. And we're working on getting another batch together at no charge. So if that's something that would be of value to you, please call Senior Concerns to see if you would qualify for one. Just checking, we're just having wonderful comments of appreciation in the chat. So just again, I just want to extend from all of us how much we appreciate you taking the time to share your knowledge with us today. So thank you so much, and I hope that everybody has a wonderful evening.
Thank you for having me. Have a good night.
Thank you. Goodbye.